Hi everyone, I'm Dr. Timothy Gallagher, and this week we have a special guest. We have our son Ansley Gallagher, and we're from Maragal Medical. How's things going today, Ansley?
Much better.
All right, so today we're going to be talking to you about how we used a innovative injection technique, a PRP injection, to help Ansley recover quicker from a fracture in the foot. You're not going to want to miss this one, so stay tuned. Okay, so a little history with Ansley's injury. Why don't you tell the viewing audience approximately what happened and when it happened and a little bit more details about the injury.
So I had pain outside my left foot when I played tennis, and my mom and dad said I should get an x-ray.
Yeah, so Ansley trains at the Thoreau Tennis Academy in Concord, and after we got the x-ray in the fall, come to find out that Ansley had what's called a stress fracture in the foot. So that was some kind of bad news because we're going to have a little downtime, and the timing wasn't great because what holiday were we just about to celebrate?
Christmas.
Yeah, and what did the orthopedist suggest that we do first?
Put me in a boot.
Yeah, so we had to use a walking boot throughout Christmas, but we only used it for about 2 weeks. And then Ansley started to feel a little bit better. He got back onto the court, but then after a couple of tournaments, you started to notice that the pain started to increase, right?
Yeah.
So what are some of the treatments that Mom and I kind of came up with to help accelerate the healing?
Laser and stretching.
Yeah, Mom was pretty diligent about the stretching, and the laser combination seemed to make a difference. Also, too, at Mom's old physical therapy clinic, they were able to prescribe some what for your shoes?
Orthotics.
Yeah, the orthotics. So we thought we were out of the woods because you started to actually feel a lot better, right?
Mm-hmm.
So then we went back to the orthopedist, and after that time, we had kind of shut him down for a little bit longer in the walking boot, and Ansley was doing a lot better. And a couple of weeks ago, we took him back to Children's, and he saw a foot specialist orthopedist. And to our surprise, after she x-rayed the foot, the fracture was still there, but you were feeling pretty good, right?
Yeah.
And we kind of talked to her about some of the different treatment options. The orthopedist was aware of the types of treatments that we do in our clinic with regenerative medicine. So specifically for Ansley, since he's only 14 years old, he didn't really need a stem cell injection because at your age, you're like chock full of stem cells. Mm-hmm. So we decided, and the orthopedist was really excited to hear, that we also did what are called the platelet-rich plasma injections. So that's a technique where you go into the office, and what happened? Who did your blood draw?
My aunt.
Yeah, Auntie Steph was able to do the blood draw, and then she took it out back, and we put it in a device called the centrifuge, which spins the blood down and separates the different components. So we got the red cells, the white cells, and then what we're trying to get is the higher concentration of platelets, because those platelets which help to what? To accelerate the healing into that fracture of the foot. So, we can show some imaging of Ansley's fracture on the x-ray and the MRI, and then we actually can show some footage of the injection procedure itself. So I know from experience, because I've had a lot of regenerative medicine injections, and we kind of prepped you going into this. Your fracture is really in a tricky spot. It's on the outside of your foot, and there's not a lot of tissue there, right? Mm-hmm. Yeah, so it's basically just bone. So I think as a parent, it was a little bit challenging for Colleen and I because we knew it was going to be painful for him. And typically with PRP, you actually get a little bit flared up after the injection. So I think that was a little tough for us because, you weren't really feeling bad going into the clinic, but what happened after the PRP injection?
It hurt a lot and I couldn't really walk.
Yeah, so that was on a Thursday, but then slowly I would check on you like Friday, we started to feel a little bit better.
Yeah.
Saturday, definitely better. And then what just happened on Sunday?
I had a lacrosse game.
Yeah, and what happened? You ended up scoring a goal, right?
Mm-hmm.
Yeah, so a lot better after that. And then what we're going to be able to do is continue with his rehabilitation program using the orthotics. and utilizing the laser to help accelerate the healing while those platelet-rich plasma injections start to accelerate the healing on his fracture. So pretty innovative treatment options, and it just goes to show the level of flexibility that we have at Maragal Medical. Now, oftentimes when we talk about regenerative injections, we're usually talking about like patients that are older like me, right? Or patients that are riddled with arthritis, but the PRP injection can really be an effective treatment option when we're talking about a younger athlete that's injured. For more information about our clinic, you can always check us out on the web at maragalmedical.com. And certainly we'd be able to provide you with a consultation to see if we can help come up with some innovative treatment options for you or any of your family members. That's it for today. I hope you learned something. Have a great day, everyone. Take care.